All right, spondylolisthesis. What is it? Very good question. Spondylolisthesis is basically if you take the posterior line, see where these dotted lines are? See how it steps? On a healthy lumbar or any section of, because you have a spondylolisthesis anyway, but on a healthy section of spine, if you're looking at the side view of it, the line should be continuous, just like this is right here, but it should be here. So you can see where this one, L4, has moved forward on L5. And over here, you've got it on L2 has moved posterior. And actually, there's a section here. It's L3, L4, L5 has moved forward off the sacrum and L2. Okay, so actually if you want to take a, you have two different ones at two different segments. So these three segments, so what causes this? Okay, number one, it's typically a pars fracture. Now the pars fracture is part of the posterior elements, and those posterior joints here is what helps hold the vertebrae in line, okay? So what happens? Kids, extension, gymnasts, divers, any athlete that does a lot of extension has the possibility of something like this. Injury, fall, lifting, anything can actually do. But it is actually an instability. So how is it treated? Depends upon how bad it is. Now you can see this has moved forward, right? So what you do is you take on this L5, for example, you're going to make lines, half and then half and half. So how far this has come, it's either going to be a first degree, second degree, third degree, fourth degree. Okay, so this typically is hanging right around 1, maybe even 2, very close to 2. Grade 2 spondylolisthesis of L5 or L4 on L5. The further forward, the more symptomology you can have. You don't need to have a lot forward to have any symptomology. Everybody's different. So what typically does happen is these little holes here are where the spinal nerve leaves the spinal cord. Down here is the cauda equina. But it comes down. Now, if you take a look at the shape of the ones above it, right, and look at the one here at the spondylo, the area is considerably lessened, okay? Now you have a stretch tension on the disc itself, right, on the annulus fibers, and you have a decreased area in which the spinal nerve leaves. You have a stretch tension on that. The disc could be issues. These aren't open, actually. There are tissue inside those. So you got to think of it, when you lose disc height, this gets smaller this way, and that could be compressed just by the tissue within the foramen, okay? So there is the possibility of some nerve issues coming in there, whether it be pain or motor nerve weakness, numbness, tingling, any sensory nerve that can happen. So to what degree of treatment? It's very important, because you may not need a surgical intervention. Typically, depending upon symptomology and severity and the nerve issues that you may be having, you can have some severe to where it's an emergency. They got to get you into OR quickly. Or you can just have localized pain down to pain down the leg, sciatica, a lot of different, I mean, there's a plethora of different ways this thing can present. And it's the severity of the presentation which helps dictate the treatment, okay? It can be treated through adjusting and some PT, some soft tissue work, those kind of things, all the way up into inserting surgically hardware to bring that back. The problem with that is once you go that route, there's nothing more you can do. Now, that I always try to say, look, there's a place for surgery, there's a place for pharmaceuticals. And believe me, I've had multiple surgeries, I've taken multiple pharmaceuticals. But not every case is either, okay? That's why any chiropractor has been trained, just like a medical doctor, to diagnose and to do tests and to find out what's going on with that. So this is actually a very big, wide type of treatment scale to therapies, to the presentations. It all depends upon a number of factors. the furthermore it goes. Now it can go posterior too, right? Just like in this section, it has gone posterior, and this section has gone anterior. So it can go posterior and it can go side to side. You can listhesis on any direction. But most typically we find forward on that. Okay? This can be, I wouldn't say minor. Now the cases that I have seen in my time as a doctor has ranged to medium to severe. Very, very, very few, I'm trying to remember, that are not that severe. There's always the danger too of nothing gets better like this over time. It gets worse. So that's why chiropractic treatments are very valuable to help slow down that practice. Now, if you just take a look at the way gravity is going to move, it's always pushing down on you, right? So if you have an incline and something's pushing down, right, it tends to slide forward, right? And that's what tends to happen with that. More and more pressure on the posterior elements to keep it there, and it just keeps moving forward and forward and forward. So that is a brief synopsis of spondylolisthesis.